Thanks very much. Okay, so we do have a couple of questions in the Q&A section. So the first one is for Dr. McLaughlin, and it says, my question is, what is the role of the federal government and the governments of the countries of origin? How can or should they act to ensure the health of their nationals working in Canada?
Thanks for the question. So there's a huge role that the various national governments play. First of all, they define the contracts. So each year, these governments negotiate and determine what the contract will be and the conditions under which these workers will come. So one major role they could play is improving the conditions of the contract in many ways. And we've written very extensive recommendations, which I mentioned on my website, about how the contract could be improved to better support the rights of workers. For example, making work permits open so that workers could freely change employers when needed would be a huge improvement. Having a formal appeals process when workers are fired or not invited back would also be a huge improvement. So just two examples. And these are, again, conditions that the various governments negotiate, but of course, Canada has the upper hand, right? So the foreign governments are essentially in competition with each other because Mexico has its own bilateral agreement, and then the Caribbean countries collectively negotiate their own bilateral agreement. And if one bilateral agreement makes conditions easier for employers than the other, well, then employers may be more likely to request workers from that country. So Canada really has the biggest responsibility here to make sure that the conditions are fair and just for all workers, regardless of the countries from which they come. And the federal government really needs to step up and improve conditions. You know, they recognized during the COVID pandemic that these programs are flawed, that they are creating conditions of vulnerability. But instead of introducing really important systemic changes that would fundamentally alter these dynamics, they offered more band-aid solutions, little bits of funding here and there to do pilot projects, improve housing and that kind of thing. But what we really need is to fundamentally alter the dynamics of these programs to give workers greater empowerment.
Thanks, Janet. We have a comment from Susan Stock, who says that social determinants of health, teaching, and writings often miss that many of the determinants of various health outcomes are mediated through working conditions. It doesn't target a particular speaker, but Elise and Janet, you may have some reflections on that comment.
Yeah, I absolutely agree with that. I found in my in the teaching that was done in medical school that work was almost never considered. So and working conditions would occasionally be mentioned, but at a sort of just brushed past. I think it has a lot to do with how complex and difficult that is, because if you consider work and working conditions as one of the major determinants of health, that requires massive changes to how we structure our economy and our society. And it requires us just thinking totally differently about what equity and equality and capitalism might look or not look like in the future. And it's just a lot easier to say like, oh, poverty is bad, and so let's fix it with this really easy social program that's not actually going to do anything. That's my take on it. So I want people to think more about it, because I want us to think about making actual substantive change.
Janet, do you have any reflections on that?
Ditto. I think that exactly nails it. And you know, I teach social determinants of health at the university here, and we do have a lesson in the chapter in the book about working conditions. But yeah, I agree that in general they're not emphasized, and we really need to, given that people spend more than a third of their lives at work often, or around a third of their weekly hours at work, these conditions drastically impact people's health. And we've heard about conditions of commuting that will add hours onto those days, or we're all living this right now where we're working around the clock with, never ending Zooms and emails. So even beyond the typical hours, people are extending that work often, well into evenings and weekends. So I think that, yeah, we really need to think critically about how we make sure that workplaces do not further undermine people's health, both like at an individual employment level, as well as at a broader structural level with like the conditions of employment, minimum wage, Labor Relations Act and Employment Standards Act, and all of those kinds of things that influence our employment conditions.
So I'm going to ask a question because but please, others, please pose some questions. So Susan comments that this is an area I'm actively involved in trying to change at both the University of Montreal and McGill. My question is really around the relationship between doctors and the compensation system. So Elise, you've argued that things like commute-related fatalities should be considered to be work-related, and some of these other issues. But Janet, you've talked about the issues with healthcare providers really, in fact, not always providing particularly accessible or supportive care for the temporary foreign workers in the agricultural sector. But I mean, are they willing, interested, based on your experience, in filing claims with workers' compensation when they clearly, there is clear evidence that something is probably work-related? So the healthcare professional role in that whole system.
I'm curious to know more about Janet's experience and stuff in this too, but my own experience, which is just anecdotal, so I should be clear, is that so to file claims with workers' compensation, you're paid from the Workers' Compensation Board, so you have to do a whole lot of more paperwork as a family physician, for example, to file that you're not necessarily paid for, which is a big issue for family physicians, especially in Newfoundland, where everyone's on fee for service. And so each person you see is a little like budget line or like amount of money. So that's one thing. I haven't seen any staff I've worked with turn down people's requests to fill out their forms necessarily. But the doctors are definitely gatekeepers. They're just the family physicians, so they don't get the final say. It's sent off to other physicians and to the compensation board. I will say that almost universally, people think that most of those coming with a workplace injury are malingering. There is, even if the person that you just saw in your practice, you signed off on their thing and said, yes, you definitely have a workplace injury, but then we'll be like, that person's real, but most of them just want time off work, which I've never actually seen either. Every single case is like, this person really was injured, but most people just want. You have to work hard to assess who just wants time off and who doesn't. And that's something that I remember Barb talking about with Dana, who was doing that research on workers' compensation stuff, that like, it's actually extremely rare that people are malingering or falsifying their injuries and whatnot, and that the impacts of workplace injury are actually really, really devastating to workers and their lives and their futures. So I don't know. I'm just speaking from like anecdotal evidence. Yeah. And I think that the payment schemes for private practice physicians need to change pretty radically in order for physicians to be able to do the kind of work that they need to do to actually help people in the community.
Yeah, I would offer similar thoughts with the healthcare providers we've interviewed over the years to try and understand why are they not making these claims. And as I mentioned in my talk, if there's a really severe acute injury, they are more likely to make that type of claim. But if it's anything chronic or not necessarily very clear cut, they're much less likely to make that claim. And I think many of them don't understand the importance of why, if they're covered by OHIP, well, they'll get covered. So why would I take on these extra steps of making a claim and filing and supporting this worker through the WSIB or the workers' compensation system? That must be a failure in the medical training. I haven't gone through it, but if they're not understanding the importance of why workers would need to be covered through workers' compensation, as many of those I interviewed didn't seem to understand, then it must not be emphasized well in their training. Among many other issues, when a worker doesn't make a claim, this is what I've seen with many of the migrants over the years, they didn't make the claim, even though, their injury was related to work. And then the injury doesn't go away. It gets worse. It persists. And then, down the road, someone might say, well, maybe you should make a claim. Well, the evidence, the documentation now isn't there if the injury initially happened a few years back. And now if the worker's injury is getting worse and they're not able to return to work, that can have long-term income implications. And if they had that support through workers' compensation, then not only would their healthcare be paid for, but they also may be able to receive benefits to help with loss of earnings. So that's really why, from the workers' perspective, it's very important. But as I mentioned, many workers don't appreciate this either through no fault of their own, because they haven't been explained the system. They haven't been explained why it's important to claim. And indeed, in many cases, they've been pressured not to claim by their employers, because employers don't want their premiums rising. They don't want to deal with the extra paperwork. So if their employer, on whom they depend for their job, is telling them not to claim, and the employer is mediating healthcare access and also telling the doctor or the healthcare provider not to claim, then those are a lot of hits against claiming. And it does result in major issues of underreporting. So we need to improve the training of all medical practitioners to understand the importance of the system. And again, on an anecdotal level, I have heard different healthcare providers just say, I don't want to deal with all that extra paperwork. So again, that is an issue. At a physio clinic I attended as a patient, they explicitly said, we're not taking WSIB cases. We're not getting paid enough from them. They're too much work. So you either pay out of pocket or we're not seeing you. And I don't know how common that type of sentiment is, but clearly there's an issue here if the system is not paying enough and it's not easy enough to get through, that providers are finding this too cumbersome and as a result refusing to see patients through that system.
Thanks very much. So thanks. I think we'll wrap. I want to thank our two presenters. This has been very rich presentations. I want to thank our participants. We've had a good, solid group of participants. And just to remind everyone that the sessions are recorded. So this session will be posted online, and there will be a follow-up evaluation questionnaire that we encourage you to respond to help promote the webinar series in the future and help us find ways to make it stronger. So lots of material here. It'll be great. I'm looking forward to reviewing it all again because we covered a lot of ground in a relatively short period of time. There is no upcoming webinar scheduled yet, but hopefully there will be more starting again in the fall. And we look forward to welcoming people back to the series in the future. Thanks very much. And thanks again to Monique and to Mike from the University of Ottawa.